Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors. And today we have Dr. Riya Sarkar with us, helping us to understand about the branch of microbiology. Why did she pick up microbiology? How interesting the branch it is. As all of us know, it is the backbone of medicine, a way to diagnose all kind of diseases, as well as to help us understand how to reach to a diagnosis, in all the patients. So currently she's working with tuberculosis in intermediate reference laboratory in Kolkata. With her studies, MD as well as MBBS done from Kolkata, she's here to discuss about the branch, what keeps her motivated in microbiology, why did she pick up this. So let's welcome Dr. Riya on the platform to understand all about it. Welcome Dr. Riya on the platform.
Good morning, Dr. Ayushi.
Thank
you for this platform. This was like something unexpected. Like all of a sudden this came up to me and I was like really looking forward to this.
Yes. Same here. So let's understand a brief journey of yours. How did it go till now?
Okay. So I have completed my +2 in the year 2009. So जो भी है बचपन से होता रहता है ना कि like medical करना है. So this was like a kind of attitude of my parents. We belong from a non-medical family. But then anyway, somehow हो गया. चलो, MBBS was done. In MBBS, you're too much of naive. You do not know what to do next. And in our field, na, everything depends on competitive exams. You clear the exams. उसके बाद कोई branch मिलती है. So finally, I ended up in joining microbiology in Calcutta Medical College in 2016. I passed in 2015, मेरा internship खत्म हुआ, and then 16 से I joined, and 19 को I completed my MD. उसके बाद हम लोग यहाँ पे we have bond. Like after your MD, you need to serve the government 3 years bond.
Okay.
So like wherever they'll give you the posting, irrespective of your branch. So I was very, very lucky enough to get something in my branch only. So I'm right now working with tuberculosis. So 1 more year of bond is left. That's it. So yeah. So this way my micro thing started. I can tell you later on like what I went through and what is it all about.
Great. Nice to know. So now, because you're fresh passed out, you must you know what are the kind of struggles you as well as your peers go through while struggling in the initial years. So let's discuss that in depth in the coming times. First, let's focus. Why did you pick up microbiome? What was your
interest? I think you also being a doctor, and if our audiences are majority are medico, then they understand that picking up a branch is not like you will think that yes, I want to do this and you'll do that. It doesn't happen like that, right? Because a lot of things have come up, like jo bhi aap bolo. Okay, it's a entrance exam, this, that. So any person thinking from the first year of MBBS, you can't say, okay, I'll become this, I'll become that. Very 1% of the people actually like can fulfill that, So when we were in MBBS, hardly micropatho, these subjects used to be terror. In first year, second year, number one, all of a sudden medical new terms and everything. And number two, you do not get that much of an exposure. It's only bookish. You just know like what to read, how to mug up the things, how to score marks. This is our main concern. Once we start preparing for this your entrance exam is when you again it's more of a mugging up thing than to like focus on some knowledge or skill, something like that. It's only like mugging up. So one thing I realized was I like micro. Okay. I would like to focus on this part. People who will take up micro if later on, you should be sure that you like the subject. There are certain people who do not like micro.
Yes.
So from the beginning, it's normal. Like मुझे कभी pathology नहीं पसंद था.
Yes.
So micro is a subject. Like after doing, I can tell you, if you do not like the subject, you will be devastated. You cannot do this. Take up this branch like just because I'm getting this branch. So okay, MD मिल रहा है कर लेते हैं. But I do not like this subject from like अगर hatred एक रहता है subject like towards this, trust me Ayushi, you cannot like devastated. I've seen my seniors if you had taken just like that, ठीक है करना है micro कर लेते हैं, MD हो जाएगा, MD लिख लेंगे, and they did not like the subject and they ended up very badly because once you are in this subject, you have to be in any subject, you have to be very deep.
Correct.
आपने जब dentistry की है, BDS किया है, so you have to be deep. All of a sudden you cannot say like a person if taking up surgery and you say that I do not like to go to the OT. It doesn't happen like that. So same thing with micro. So micro में lot of people, actually a काफी chunk of people रहता है who do not like micro, in second years and all. But if you are really a hater upon this subject, you should not come up to this branch. This is my honest thing. So मेरे लिए वो नहीं था. Like it was a terror in second year, but gradually I liked it. Like, me and our batchmates, like there were a few friends of us. So I had some other subjects also in my mind, but I also had if I had to do micro, patho, this kind of area, I'll go for micro because that was interesting to me. So that was written in my fate, I guess. So like, I got in one of the premier institute. Calcutta Medical College is like a real premier institute. So I just got it. So like, yes. So then started.
Great. Nice to know. And actually what you mentioned is important, that and it's normally said what branch you pick up in your master's, you get married to that. So it's very important to
actually, and you need to be committed, right?
Yes.
You have to be committed to that subject. So you should be very, very much like, aware. देखो, जो लोग join करते हैं, it's very difficult for them to be aware what are the pros, what are the cons. But at least you should know that I can deal with this subject for my entire life.
Correct.
There are certain things like certain people like cannot do this particular subject, or certain people who cannot like one particular branch, but then they just go on and they end up like feeling depressed. Like, what will I do? You don't do well in the subject. You don't like, get to know the nice things of the subject. So like, that should be your first thing. You should like the subject.
Correct.
If not like, you should not hate the subject. That's my main funda. You cannot hate micro and enter micro. No.
Nice to know about that. So now when you are in the branch, how do you think, the scope in microbio, and how is it evolving in the future?
Point is that when we join micro, internship of whatever training we have, we do not have any kind of training in these subjects of micropath or laboratory,
Right.
All we know is test ka naam likh diya, sent, within 24 hours, the result is supposed to come. If it doesn't come, you just call up the person and you just like, scold the person that why am I not getting the result? The patient is suffering. This is all idea we have. So I also kind of had that idea. But when I came up with this subject, I saw, okay, there are certain things you need to be aware. Like, for example, if somebody is sending a blood culture report of a patient, obviously the patient is serious, patient ka fever hai, and you are not understanding what drug to give. But at the same time, micro is not a subject where you are determining one chemical in your blood. I am determining the presence of one organism. So that organism is living. So you have to keep in your mind, you have to let the organism grow.
Correct.
Like, आज आप मुझे बोलेंगे कि आपका TSH, thyroid के लिए TSH level कितना है? I can check the thyroid का level and I can give you the result. But if you say, what is the load of my bacteria? I cannot tell you directly. You need to let me first grow the bacteria. So that requires a time. So this is one hindrance, I think, like, this is one communication gap which we micro people and the physicians have, because they obviously from that point of the time, I understand the patient is doing bad. They are not understanding which drug will they respond to. So they are really looking forward to us. But again, it's not that these people are not working. People have an idea that you're not working, you're sitting, that is why, it's getting delayed. It's not like that. You have to give time. So first thing, medical में, I think one improvement should be done is communication. इंटर्नशिप से आपको पता होनी चाहिए कि किसके लिए कितना टाइम लगेगा, किसके लिए क्या भेजना चाहिए. लाइक आई विल टेल यू जस्ट फॉर योर इंफॉर्मेशन, अगर आपको कभी ऐसे ब्लड किसी के पेशेंट के लिए भेजना है, देन आई वुड सजेस्ट कल्चर छोड़ के आप एक ग्राम स्टेन के लिए भी भेजो. Why? Because gram stain, I can do it immediately and let you know that whether I am seeing one gram positive organism and negative, at least you get the clear idea which drug not to give. Correct. If not what to give, that I'll tell you later on, but what not to give, that you can segregate.
Yes.
So you should be aware from that side. Like if I'm sending only for culture, I'm not going to do the gram stain for you. You have to tell me that do the gram stain. Correct. But again, for that, you need that information. मुझे लगता है ये बहुत interpersonal collaboration, this communication is very important. This is lacking very much. I do not know about abroad. I think they work more in a better, better way. But in our India, in government sectors, we really do not communicate at all. People are like, इसको उसके ऊपर blame देना है, that person, this person blame, and this circle is going on and on. So if the communication thing goes better, a lot of scope and lot of improvement is there.
Correct, correct. That's so true. This is very important with medicine, to connect and to interact.
Have to connect.
Yes, yes, yes. So now, why, as we discussed, how do you think the scope is improving in microbiology in the country? I understand that you are also a fresh graduate, but still, since your graduation till now, how do you think microbiology as a subject is, and how important it is?
फर्स्ट एक जो हम लोग का एक फॉल्स चीज चल रहा है इन द सोसाइटी, microbiology is also one subject which is non-medical.
Yes.
People do MSc microbiology.
Yes.
So a lot of people tend to confuse the thing that, this is a medical microbiology and there is certain part of non-medical microbiology. So, matlab, jab bhi, like, even our medical fraternity people, they tend not to differentiate between the two. So this is one like, there were 2 or 3 colleagues of mine who were doing MSc microbiology with the thought कि okay, हम लोग MSc medical microbiology कर लेंगे, so we are at par with doctors. A lot of people have this kind of thinking. But the point is, for medical microbiology, you need to know the human anatomy से लेके आपको medical field में आना पड़ेगा. Correct. Right. So that way, there's a bit of confusion in the general mass, I'll say. But again, as a subject, if I tell you, it's really interesting. It's interesting as in you really get to understand, like, कि अगर मुझे एक दिन में एक organism पता चल जाता है, you really know कि I have to give this drug and I do not have to give this drug. Correct. And it actually saves the patient. I'll not tell कि a lot of physicians do not wait for the report. Like, they give erroneously the drugs. So उसके लिए काफी सारा antibiotic resistance भी आ रहा है. So since this antibiotic resistance is coming up into play, like, for that हम लोग का रोल अभी कुछ ज्यादा ही बढ़ गया है, because like, this thing is a big topic right now. Antibiotic resistance, you see anywhere, journals, clubs, anywhere, like antibiotic resistance because of overuse. I understand, as I told you, कि आपको report timely, you think that I'll get the report now, you're not getting it today, so you're just starting on empirical antibiotic just like that, but that is not working for the patient, but in turn creating a resistance on it. So for that thing right now we are really working. Micro full setup is actually working on antimicrobial resistance. Abhi to chalo pandemic ki wajah se the entire shift is on COVID, but antimicrobial resistance is one big thing that is coming up. It has already come up. अगर माइक्रो में कोई कुछ करना चाहता है, apart from the normal regular thing, this is one thing. आप research करना चाहो, you can go for that. You want to be in some corporate sectors and you want to be in the, like, antimicrobial the group of people who are like together facing like which drug to give, which drug not to give in a hospital, which antibiotic to be replaced with another. You can come up with that. Like, so that way the thing is coming up. Micro is a subject which I think it is growing with a very slow pace, not like abroad. In abroad, you really have very, very good setup of micro, what I've heard of. Like, I do not have any practical experience, but they have a different idea altogether. Like, they completely work as a team. हमारे यहाँ पे जो मैं बोल रही थी, एक तो हमारा communication gap is one thing, and second, we do not work as a team. In abroad, what I've heard, like, there's a team, one team consists of the physician, the micro person, the patho person, like everyone together is working as a team. So if you are not being able to give some suggestion, I from my end, I'm giving you some suggestion and the thing works like that. But अभी तो यहाँ पे वैसा कुछ हुआ नहीं है. So we have a long, like, long place to go.
Correct. That's true. So now, nice to know about the branch and how it is evolving. So what are the kind of job opportunities in microbiology? If somebody passes out after, the medicine microbiology, what are the kind of job opportunities in that?
This is one, I think, old time question, like, kya karna hai? Like, how to earn money, I think, yeah. But then that is true. Everywhere you have your saturation, everywhere, be it any branch, medical, non-medical, any kind of thing, you have a saturation because people are good. To be very honest, whoever is doing what, they are good. Yes. So like, ऐसा तो है नहीं कि like, I am the best and the other people are not knowing anything. Everyone has that equal amount of potential, effort, and everyone is good. So if I like tabulate it for you, then there are a lot of people who actually, there are a lot of girls rather. I do not believe in this. Like, ladki ho, so you have to take up this branch. It's not like that. But a lot of people want to give time to their family. A lot of people, it demands, like, at the end of the day, your family demands. So for them, a lot of people do not want to work in the clinical area. So for them, this subject is very good. You can join any government medical education service. You can join any, the hospitals which are providing DNB degrees. So as a teaching faculty. Correct. So if you want to remain in a lot of people, like, during MBBS only, a lot of batchmates, they used to say, like, we love teaching. And there should be good teachers. Because if they don't teach you, how are you going to become a doctor? So that is like one basic of your medical field. So for that thing, this subject is very good. Government karo, private karo, DNB padhao, MD लोगों को padhao, anything for teaching procedure, it's very nice. Yes. But again, you have to be very good with the subject. Micro is again another subject. If your teacher is bad, you will never like the subject. Yes. I completely believe this. For any subject, a person, आपको अगर अच्छा लगना होगा subject, then the teacher has to be very good. Correct. And for the teacher to be very good, you have to like the subject. So it all comes down to that thing. If you do not like the subject, do not enter this branch. Like, basic. Yes. Next, you have a lot of people who want to go only in the clinical area. So for them, corporate sectors are there. There is a saturation, no doubt, because unlike other branches, maybe a particular subject you need 10 people. Say anesthesia, you need 10 anesthetists. But normally, एक पूरे hospital के लिए you generally do not require 10 microbiologists. So you have to keep up that in mind. कि it's not like मतलब आप सोच नहीं सकते कि okay, my colleague is of this branch, he is getting easily into this, I'm not. You will not, because कुछ हर अपना subject का limitation होता है. Everywhere, like, you have number of people standardized that way. So, but corporate area, people are doing really well. The senior people generally take up the higher post, but junior consultants and all, just for the starters like me, like, अभी मेरा अभी खत्म होगा अगर bond. So if I want to do some senior residentship somewhere, so you just join as a starter, fresher. You work with low pay scale apparently initially, but then gradually, obviously, your time will also come, and then you will eventually do well. Again, you have to do well. Like कहीं पे भी कुछ करने के लिए, you have to sign up in that particular area. You have to really do well. So that way, एक education हो गया, एक आपका corporate sector हो गया. You can also, a lot of people, who can afford to do it, we are doing the labs. A lot of people are from पहले से like थोड़ा सा business monetary mind के अगर होते हैं, that is also a very good thing. Somebody was telling me last day, like one pathologist was telling me last day, कि like Riya, if थोड़ा सा पहला funding करके आप एक lab खड़ा करा दो, after that it's profit and profit. Correct. If I'm talking only in the money point of view, like career and money point of view, then you just need to have good doctors, good microbiologists, good biochemistry people, good pathology people. The report should be good. Yes. The report should be good. That's it. After that, आपका turnover तो बढ़ेगा ही. But for that, you have to have a very much business mind. Like, we Bengalis generally do not have much of a very business-oriented people. We are not. But a lot of my friends, specifically, like, North Indian people, like, we were from the idea, they were of the idea कि अभी तो इसके बाद हम लोग को lab setup करना है, इसके बाद हमको hospital बनाना है. So that, if you have that mindset, it is very good for you. You can open a lab. Funding initially लगता है, so that like थोड़ा बहुत ज़्यादा struggle करना पड़ेगा. But then if you really do well, this is a very good thing. Specifically in peripheral area, I'll tell you. मतलब in metro cities, all of a sudden आपने एक lab खोल दिया, it might not work because metro मतलब बहुत सारे labs already hold up किए हुए हैं. But you go slightly periphery, थोड़ी side में जाओ, थोड़ा सा पैसा लगाओ, and you have that thing कि like okay, proper business में जाना है, then lab is also a very good option. And there are certain people who really want to like see patients also and teach also. So for them, I think medical education service, MES, is one of the best thing. Like, you do your work also with your uttermost sincerity. You can teach the people also, and like you get kind of a name. People really remember you. What I think, हम लोग के medical field में, this is one thing. Like, in school life, you do not remember every teacher maybe, but in medical field, for some you talk about one subject and there is that teacher. Yes. You have to name a subject and you know that teacher. So that is how our medicine works, I guess. So yeah.
Yes, that's true. That's true. Our teachers make our base. That is the reason.
True, absolutely.
Yes, yes. So glad to know about the opportunities, and actually, setting up the private practice in peripheries is a very, very important thing that
And periphery में क्या लोगों को भी तो help मिलता है ना? A lot of people who are not very much like I'm not say rich, but who cannot afford that much, and they stay in the periphery. A lot of our population who stays in the periphery who do not get good reports.
Yes.
When I had joined micro, one of my teachers had told me one thing. Riya, always remember what do you do inside the lab? It is not that important. What you give to that particular patient, that is important. When we go to a restaurant, what we order, how are they cooking, what the chef is wearing that time, that is not important. But how the dish is coming to you, that will make you like, I'll again visit this place or not. Right. So similarly, like if you, agar aapka report in government sectors, we do not type. Like private may we give it type. Yes. Report, na? In government sectors, we write in a hand. So she was, and like there are like 200, 300 in a day. So you just tend to scribble and write. Like doctors, we have this thing, na handwriting. हम लोग का तो बहुत poor होता ही है. So my teacher told me, कि like you don't need to give that much effort. अंदर में क्या हो रहा है? But when you're writing the report, think that somebody is going to see only that.
Correct.
आप एक physician के पास जाओ. So the physician will remember your face. कि okay, this doctor was good. But if in our case, where generally we are the shadow doctors, we are not coming in front to the public, so उन लोगों को हमारे face की जगह पे only वो report दिखता है. So that should be lucrative for the person to come up again. So that way, I think like peripheral area, as I was telling you, a lot of people do not get a good report because doctors do not want to go to the periphery and settle down. Everyone we want कि हाँ ठीक है अच्छे से metro में रहते हैं, tier 2-3 cities में रहते हैं. So it's like periphery में अगर थोड़ा सा आप invest करो, it can give you like good remuneration.
Yes, yes, and maybe because of the quick reports also, maybe in the periphery, because agar even if there are collection centers for big laboratories, the reports are not that quick to get because then they transfer.
Exactly. Lot of places, what happened? Like they give the blood there. Then from there, it has been transported to say the metro city. Yes. Now here I'm taking my time to give you the report. Then again a transportation time to go to reach the periphery. So that thing will easily get like vanished if we think of like periphery में कोई setup करा लो. It will be good for everyone, the patient, for the doctors, for everyone.
Exactly. The sample does not get spoiled, and you get better reports. Yes. Mm-hmm. Correct. Nice to know about this and understanding. So now, when you have mentioned about the different kind of job opportunities in India, from private to jobs to, to the education side, if in brief, you can tell us about the scope internationally, if you have any, idea on that.
Okay, I do not know, and like I am not very much aware of everything, but yeah, what I know from the beginning is in abroad, micro is a really very what will I say, a big branch. India में अभी वो है नहीं, but abroad you have that thing because they mainly focus, as I was telling you, the antimicrobial resistance. They do not like that in their society, there will be antimicrobial resistance. They really want to work on that. We do not have that mentality. We are like, अच्छा ठीक है, ये drug नहीं दे रहे तो दूसरा दे दो, बस patient ठीक होना चाहिए. But they do not have that thing. You have heard maybe like one person is allotted to one doctor only. You cannot randomly go and show anyone there. I've heard this. I do not know how much truth is it inside it. But then they're like, if you have to show to one physician, you have to show to that particular physician. It's not like us. Kya jisko dikhaya, kal ye, like, I did not like him, so I went to the XYZ person. So it's not like that. So micro that way, it is a very, it's like an upcoming branch in India, but internationally, it is actually a well-established branch. People have observership programs, they have fellowship programs, and they have a lot of things. Like micro itself has branches like, mycology. Okay. Which we tend to talk very less about in India. Mycology means fungus.
Okay.
हम लोग को उतना importance लगता नहीं है.
Yes.
But while I was working in medical college, I saw places like cancer patients, specifically neutropenia, cancer patients, bone marrow transplant patients. इन लोगों का main source of infection is a fungus. So if your laboratory doesn't have a good mycology base, you will never be able to give like. It's what will I tell you? अभी एक religiously एक चीज बन गया है. Like I'll give you a report. I do not know, have you come across? You get a lot of no growth.
Yes.
Like what is your report? You're waiting for the report. There is no growth.
Yes. Yes.
A lot of in cancer patients, the physician doesn't send perhaps for fungus because we are not taught from the beginning, like, that fungus is an important point. Like, even when I'm talking to you, you also seem to be like, okay, mycology is something.
Yes.
That
Yes.
is the point. We always know bacteria, virus. एक virus होता रहता है, bacteria होता रहता है, fungus पे कोई नजर ही नहीं देता. And for that we lose a lot of patients, trust me, because fungus is something, it is devastating, it is life threatening, and it has got a long course of treatment time. So if you do not think pehle se ki, it's a cancer patient, I have to think about the fungus, and your laboratory has to be well equipped to let you know that, fungus hai ya nahi hai, and what drug to give and not to give. So that is one very vital area. So these areas are very much well established outside, abroad, I guess. I am not very sure about this, but then I think like they are well maintained about this. Nowadays, hum log yahan pe bhi like karte, like, my husband is in Hyderabad. So like he tells that in his area, he had done his MS from Calcutta, but now he's doing his MCH from Hyderabad. So he tells me like, Riya, the basic difference, when in Calcutta we used to send one sample, we never sent for fungus. We did not know that that is something which needs to be sent. And here, like, on a daily basis, I send for some fungus, and fortunately I get reports, and we change our drugs according to that. Like, say I'm suffering from a fungal infection inside my body, but you are only testing for bacteria. So I'm giving you a report, no growth. And you are like giving me multiple drugs and I'm not improving at all. So because you're not thinking at all that something else can be there, this edge, I think, is present internationally more. Because in India, we do not, abhi tak hum log to itna zyada karte nahi hai. Like, I'm really interested in mycology, I'm only asking people like somewhere like, koi fellowship karate ho myco ka, because that is like a really interesting branch, but not yet. Abhi tak utna kuch pata nahi chala.
Okay, great. Nice to know about this, glad to know about mycology. Also, if you know any other branches जिसमें fellowships वगैरह होती है.
India में right now, you have fellowship of पहले AIMS जोधपुर में.
Okay.
They were doing one fellowship of infectious disease. अभी recent, I think, pandemic की वजह से बंद है. Then you have an SGPGI Lucknow. SGPGI Lucknow also we do, that is known as PDCC, Postdoctoral Certificate Course.
Okay.
PDCC in infectious disease. Because infectious diseases, that is coming up like really nice. You have DM only in AIMS, Delhi. DM. Normally, DM infectious disease, people tend to take up medicine people only, but AIMS New Delhi is one area where you have both medicine and microbiology people doing DM infectious disease, and also MD tropical medicine people are also eligible for that. So if somebody is listening here, I can actually like tell you, like, बहुत जन tropical medicine करने के बाद भी they think that what I do. So like, AIMS New Delhi is a place where they give support to all the MD medicine, MD tropical medicine, and MD microbiology to pursue your DM infectious disease.
Okay.
Apart from that, people who are doing MD medicine, they can do DM infectious disease in CMC Vellore also.
Okay.
And from this last year, 2026, CMC Vellore has started a new DM course for micro people, that is DM virology. I think the pandemic ke baad se ye start hua like ye, but they have only 2 seats. The good bad thing is that everywhere you have only 1 seat or 2 seats. AIMS you have 1 seat. This one, the CMC Vellore, All India you have 2 seats. Then PDCC, SGPGI Lucknow you have 1 seat. So that way the competition is very high, because as I told you, everyone is good. पहले समझ में नहीं आता था MBBS में what we used to think, okay, she's studying, she's not studying, so life में यही आगे बढ़ेगा, ये नहीं बढ़ेगा. But then gradually after coming like 10-15 years down this line, you realize that everyone is good.
Correct.
So this is like, that way it is very tough. To stand out is a big thing.
Especially for 1-2 seats, it gets very
absolutely.
So nice to know about the fellowships and the further studies in this. So now when you are in the branch working on it day in and day out, what are the positive things and the challenges that you face every day?
Challenges, as I told you, you have to stand out, because this subject is such that there are a lot of people, there's a lot of saturation, like I told you, but you have to stand out. And for standing out, like, effort dena padta hai. You have to give in a lot of effort. So it's not a very much, piece of cake work type, like, okay, I'll do something and like, people will know about my work. It's not like that. So that way, thoda sa struggle hai. Thoda sa, another struggle which we face, like people who do clinical branches, they tend, I told you, they tend to have an idea, okay, okay, you are not working at all perhaps. So the
Mm.
communication gap, if I get any opportunity, I would really like to bridge this communication gap between this physician and non-physician part, because a lot of things जो मुझे पता है, actually as a physician you do not know, and same vice versa, and we tend to just put the blame on each other. So that communication part, I really feel that's a big struggle, like right now I'm working with tuberculosis. I am working mainly with MDR and XDR tuberculosis. Okay, so for that thing you really need time, for
Dr. Riya?
hello.
Yes, yes, yes. Now we can. We just.
Yeah. So I was just telling you that I'm working with MDR and XDR TV. So for that you really need time. कि like कौन सा drug देना पड़ेगा. You need time. But at the same time, I understand the impatience of the physician also. उसका patient खराब हो रहा है. That person is not getting a drug. So that is one a severe cons of this subject. Like you need time. I can't like we can't help you. We need time. At least for any kind of organism, you have to give me a minimum of time, which is very alarming, which is actually like challenging. And the source of the subject is, there are a lot of areas you can focus on. If you do not like bacteriology, you can always go, as I told you, this fungus thing is coming up. You can yourself work on this mycology. You can work in infectious disease. You can work in ICU. If you want to just stay in teaching line, you can stay in the teaching line. So there are a lot of areas, but you have to be aware of everything. You have to know that you have to be focused. We were discussing before also कि पहले से पता होना चाहिए that I'll do this.
Yes.
In midway, you cannot just deviate कि okay, I'm not liking this, so I'll just shift up to somewhere else. तो फिर like थोड़ा दिक्कत होगा. But otherwise, if you're focused, I think you can do well.
Yes, yes, yes. That's true. That's true. So, and what are the positive things that keeps you motivated every day in this?
I don't know. I'm a very like मेरा बात सुन के I think you understand. Like I'm a very क्या बोलूं, not so शांत kind of person. I'm a very chatterbox and I like going here and there. So when I was in medical college, so I was talking about this cancer unit. So the cancer unit is to keep in touch constant with me because I was very active. Like this is happening, that is happening, this fungus, this bacteria, you give this, you give that. So that way I got a lot of positive feedback from them. That we have never seen micro people working so much. So that is one thing you really understand then कि माइक्रो में एक इंसान जब आता है, एक तो आपको आपके peers से पता चलता है कि okay, even if you do not work that much, it's okay, it's like that. And you also have that physicians के that notion is there कि okay, मतलब उतना ज्यादा communication का जरूरत नहीं है. But once you yourself bridge the gap, I actually did, like you get so much of positive motivations from other people. Like you tend to realize that those doctors are also interested, like what new is happening, what you are finding, and what needs to be done. And once they also understand kitna time lagta hai, kya hota hai, so they also feel confident. So that is one thing, it's really nice. Like it motivates you कि okay, like somebody is looking towards you कि ठीक है आप बता दोगे timely, like what I have to give, what report I'll give, what report I'll not give. So that is one thing, it's very satisfying. Sometimes it's disheartening also, because sometimes we really need time, and I understand, like I need time and the patient doesn't have time. That is very, very disturbing, but then quite satisfying at times.
Yes, yes. And that's true. See, most of the diagnosis comes out of microbiome departments only. So, it's as well as, treatment plans, all of the kind of treatment, plans, what to do, what not to do. So definitely it's a kind of branch that creates a backbone for many of the physicians, and completely agreed by your statement of communication is so important. It's desperately
I would also like to tell everyone, like who are pursuing micro, who are pursuing, or just pass out, or like doing whatever, if you're in a medical field, make sure like you try to know about every subject. हम लोग को तो बस during our graduation we just read, but after that when you actually come in the market, you really need to have idea about every subject, because we tend to know only our subject, and we tend to, as I said, blame the other one. But it's not like that. You should know everywhere. I'll just give you one last example. Like, मैं हर किसी को बोलती हूँ. When I was in my internship, there was a patient of diabetic foot.
Okay.
पैर में diabetes के लिए ulcer हो गया था इन्हें. So diabetic foot. So they told, the sister came and told me, take a swab and send for culture. So we did not have any idea. I was thinking, yeah, I'm like an intern. I'm doing like, I just took the swab and I like took the swab pretty nicely and I sent it. And after 48 hours, the report came contaminated. And so it did not help us in any way. Like the patient also did not get report. So I was like, okay, I did not know that I had created that massacre. When I came up in micro, I realized that there is a particular way of taking a swab.
Yes.
Like, say in my hand, you have a lot of contaminant organism also. So you have, during taking a swab, you have to be very alert that you take up only the pathogen area.
Yes.
And not the area, surrounding area. And as an intern, I was like, never thought about this because there was no communication. So we were like, just take the swab. So I took the area, I took the contaminated area, I took everything and I had sent it for culture. And the report had come contaminated. I realized later on, my God, for one fault of mine, the patient did not get the report because I was at fault, because I did not know, lack of idea. So I would really like to tell people who are completing your internship after your studies and all, have a basic idea about everything.
That's true. That's true.
अगर उस साइड से आप ही अपना सैंपल अगर ठीक से भेजेंगे, then naturally from here the reports which you give, no growth and contamination, these two are the very disheartening reports that come up from a lab. So that will reduce मतलब बहुत ज़्यादा. So if everyone is aware, that is my last thing, that communication is very, very important in this branch specifically.
That's true. That's so correctly said. So now, any motivational words from your end to motivate this, the upcoming graduates to pursue this branch? That motivated you also.
Motivated in a sense. First thing, you do not like the subject, do not enter this branch. The mantra, the golden rule, you cannot. Just for the sake of writing MD and naam ke paas mein, that is by doing this MD, do not do that. Second thing, a lot of people maybe आप कुछ और करना चाहते हैं, but you gradually end up in micro. Do not lose heart. There are a lot of things in every branch. You need to focus on that. As I told you, there are multiple areas. If you do good, you will be recognized. There will be, like, say, you want to do your dream branch, say some XYZ branch you want to do. And there are 100 people there. You are on average of one of them. So anyway, you're not going to stand out. Correct. But in a place where maybe it was not of your choice from the beginning, but you actually did very well in the branch, you can stand out. So I'll not say someone, okay, you should take micro because of this and that. It's up to you. Jaise aapne bola, this is like a marriage thing. So you have to decide you will deal with this or not. But once you come into it, I would say, give your 100%. More than 100% in any branch you go, but give your 100%. You should give your heart to it. It should not be a duty. Then I go home. Give your heart to it. You will stand somewhere. You will get kind of satisfaction. Like everywhere you get satisfaction if you want at the end of the day. So, but micro is a good branch. People who really like it, you can actually do well. I have not started my career abhi tak bolne se, I'm still my bond, but I really think you can do well. There are a lot of people who want to do research and all. Micro is a very good subject for that also. A lot of people, like ये जो कोविड में इतना जल्दी जो वैक्सीन निकला, इतना जल्दी जो इतना सारा पेपर्स निकला, that is because people are willing to work on them ना. If we did not have so much of interesting people, then this wouldn't have happened so nicely. So whatever you do it with your 100%. That's my only thing. And if you do not like it, do not do. Take another year, take more chances, but just do not randomly come up with specifically this branch. This subject is difficult, no doubt.
That's true. That's so correctly said. And so rightly guided in the branch of microbiology. It was really so nice hearing to you, Dr. Riya, to understand about your journey as well as your understanding about the branch. I'm sure everybody out there must be enlightened about microbiology. How is it evolving? How much scope is there inside it? And so many different areas to work on after doing your master's also is amazing to know.
Yeah.
So thank you so much for guiding us on this today and taking out time for us. And
thank you so much for providing this platform. I did not think I'll actually say so much. But gradually, like after, like you kept on telling something, so I actually told. I realized that people need to understand. People need to have an idea from outside also. Even when I was joining microbiology, मेरे पास भी I had a lot of questions like what to do, what not to do. There was no one to guide. So as you say, like there should be someone to guide. So this is a very great platform that you've started. I hope like again we'll meet on this platform someday.
Definitely, definitely. Thank you so much, Dr. Riya. And we are always glad to understand anything from your end. It will be really nice. And thank you so much, everybody, for joining us at this time. I'm sure this discussion, this fun discussion with Dr. Riya, would have helped you to understand about microbiology as a branch. How is she, learning about it, evolving in it, and how can you also do it if you pick up this in your masters? Do share it with your friends and colleagues. I'm sure this will help them also to understand about this branch and help them understand how can you become better. If you want to set up your private setup, this is one of the best branch to pick up to to expand as well as to create a lot of profit.
Absolutely.
Also do follow us on our YouTube as well as Instagram channels. There you can find all our old videos that can also help you in your case. So Doctor, yeah, you were saying something.
No, that's what I was like. I just hope that whatever I told, like somebody gets something out of it. Like kuch kaam aaya at least. Tell me, give me your feedback if you get any kind of feedback.
Yes, sure. And in case of any doubts, any confusions, Dr. Riya is always there. If you want to contact her, do let us know. We will definitely help you to contact her and solve all your doubts in whichever way with microbiology. Thank you so much, Dr. Riya. Thank you so much, everyone, for joining us at this time.
Thank you, Dr. Ayushi.
Thank you. Okay, bye-bye, everyone. Have a nice day.
Bye.